and I'm going to be talking about our experiences, particularly with clinical decision support in improving quality and outcomes in the UK, and actually internationally, because it's an international product that we produce. So I've already been introduced, so I won't dwell on this slide, but my day job is around the content creation and updating of BMJ best practice, which is the point of care tool that I'm going to be using to illustrate my talk. So what are the problems we're trying to solve? I've just tried to highlight a few of them on this slide. I'm sure many of the clinicians in the audience and other people working in healthcare know there are many, many issues that we face. To start with the graph that we have, that's really just showing the ever-growing amount of research and evidence that's being published all the time, every year, day by day. And not only is it absolutely probably impossible now for clinicians to keep on top of all of that publications, but there's a lot of noise going on. And so of all of those, what is relevant? What is changing practice? What's important to know about? Underneath that, we moved to something completely different, which is unwanted variation in care, and that happens globally. It happens in every healthcare setting, and it happens throughout the whole course of the patient journey: prevention, diagnosis, treatment. There's variation in all of that. We also have an epidemic of overdiagnosis and tablets being created for every single possible condition, whether it needs it or not. And so we have overdiagnosis and overtreatment, but conversely, we still have underdiagnosis and undertreatment to deal with as well. And all of these things have led to a recent increase in quality improvement and the need for continuous improvement in care, adding yet another thing that busy clinicians need to do. So what is the physician point of care tool, for those who aren't familiar with them? They fundamentally support clinical decision making. And how they do this is by integrating that evidence which is actionable, but also taking expert opinion on that, because bringing the two together is what gives you really practical guidance that can be used in real time for diagnosis and treatment of patients. They're very highly structured, which means they work very well in the clinical workflow. You can use them during routine care, but it also means that they can be integrated into EMR, EHR, and provide part of the e-health ecosystem. And they're also constantly being updated with latest evidence-based research and guidelines to help keep on top of that constant publication of research nowadays. So I've also already started to highlight some of the ways that these point of care tools can help. But fundamentally, I think, again, they save clinicians time. Clinicians are busy, they need more time for patient care and to treat patients, and these tools facilitate that. They help to standardize best practice, and that could be sort of in your local hospital, it could be on a regional or national basis that they do this. And through sort of giving good, consistent recommendations, they help to minimize the chances of medical error, therefore improving patient safety too. They help to prevent the under and over diagnosis and treatment, and also treatment delays as well, and diagnostic delay. And they provide currency with this updated evidence happening all the time on a continuous basis. And what's really important to me, I come from an evidence-based medicine background, is that they're also promoting evidence-based but also transparent decisions. So you can clearly document why a decision was made and that was the best decision to make. So just a few points about best practice itself, just to give you some numbers. We have thousands of medical images, clinical guidelines and references involved in the product. We have Cochrane clinical answers that are fully integrated, and I'll come back to explain those a bit later. We also have medical calculators, and we have interactive treatment algorithms. We have over 800 of those, which have over 3,000 patient groups, and that goes right down to over 12,500 subgroups. The reason I sort of stress that is that it's really helping to try and get down to that individual level of care. What do you need to know for the patient in front of you at that time? So it's available as an online tool, but it's also available as an app, which is really important because it means that that information is available wherever you are at any time, and it promotes being able to find really quick answers to clinical questions. And I wanted to say it's not just me saying this, so we've been independently analysed in studies, and one of the things I want to highlight at this conference is how well we perform on differential diagnosis, because I think that's hugely important for telemedicine and e-health. and in one study we were found to be the best diagnostic decision support tool out there, and the most appropriate for use in the clinical setting, which again, it's not a point just having the information, it's having useful information that you can quickly find, contextualize and use in clinical care. And then some validation for the sort of the work that we do and the product itself as well, that it's really high quality, and it's high quality across many domains, including the editorial quality, the evidence-based methodology that goes into the tool, and the breadth of disease coverage that we have. So I just wanted to move on to a few things that we've been doing to sort of even further improve the tool and what we're doing. And a really exciting thing that we've introduced in the last year is around important updates. So put simply, these are summaries of practice-changing evidence, and they're added really quickly within 1 month. And we're not just adding alerts into the tool, we're updating the entire content that's relevant to that new evidence and putting that all in there so it's easily accessible. And then you can see sort of we list them all as important updates. You can find what's been recently updated and a list of important ones. But when you go into an actual topic, you can see straight away whether this topic has an important update that's relevant. So if you're visiting all the time, you can see, has something changed here? And you get a nice brief summary of what is the change, why that's important, and then links into the full content and also out to that original sort of guideline or landmark study if you want to read more about it. I mentioned Cochrane clinical answers earlier, and again, these are really important because they allow this application of evidence to a specific patient group. And again, we have them embedded into our content, so you can find really easily when you're on that clinical decision, is there evidence behind it? This is really important, particularly for grey areas and where there's difficult decisions to make. And when you click on those, you get to see what question were they asking. So we take it, whatever title or things that people were trying to say, we really simplify that into, is this the clinical question that actually you have in mind? And if it is, this allows you to dig right down into that evidence, so you can see high-level sort of summaries of the evidence and what happened, but you can go right down into actually what patients were included in that study. Are they relevant to the patient you have in front of you? And you can even look at the sort of meta-analysis that underlies that and the numbers behind absolute risk and things. I mentioned, and other speakers have mentioned as well, that really one of the important things around eHealth is being able to include patients in their care. And so it's really important that we have informed patients. And we do this in best practice by having over 300 patient leaflets, which are all written in lay language. They're really easy to understand, and they can be easily printed off from the system as well, so they can be shared with patients. Not only can you do that, but you can use them within the best practice tool itself. So this is one of our treatment algorithms that I mentioned earlier. This one's for prostate cancer. And I don't know how, it's probably not that easy to see, but for the last group, all of those treatments, all 4 treatments are first line. And it's not that you should just work through those in order. It means that any of those is an appropriate first choice, but the appropriate first choice for the patient in front of you may be very different. And so what's important then is that you can have a discussion with your patient, and best practice will provide you with the information leaflets that you can share with them. They can digest what's important, realize that their values and preferences are very important in the decision that's being made, and contribute to that decision. And then lastly, I just wanted to talk about one of the innovations that we're working on, which is really about accelerating evidence into practice. I think many of the clinicians, again, will know that it can take a guideline 3 to 5 years to integrate a piece of evidence and make recommendations on that. And that's just too long to be waiting to be sort of acting with the latest evidence and being able to give patients the best care. So this is a collaboration between the print journal, the BMJ Best Practice, our point of care tool, and Magic App, who are a group that use Grade to facilitate all of this. And what happens is when a new landmark study is made, comes out, within 90 days, there's a systematic review to put that into context, and then a panel is convened of experts, of patients, who together make recommendations on, or maybe just one issue, one single recommendation, but you can put that in practice into 90 days rather than 3 to 5 years. So we had these lovely visual infographics which are interactive, and again trying to not have a long guideline with lots to read, but really highlight what's the key information quickly, what do you need to know, and for sort of maybe some more educated patients, something that you could share with them in clinic. So you can see it's really clear what the recommendation is, what the strength of that recommendation is, so you know straight away what the quality of the evidence is. And again, it's all about that layering, being able to dig down into the underlying evidence. Is it really relevant to the patient you have in front of you? What outcomes did they look at? How important were things? And it takes it to the next level. So based on these recommendations and all that information, it's also entered into a shared decision tool. So for each of these, we have a shared decision-making tool, which makes it really easy to say, of the outcomes that we know about the evidence, which ones are your patient interested in? You can easily put up two outcomes to compare. So here we have, the need for antibiotics versus the time of onset to relief. And then you can show the patient, what are the pros and cons? What are the benefits and harms of what you're about to do? And not only does it have the numbers, but it brings into that as well preferences and values. So if the patient means traveling in every day for blood tests or for a treatment that can't be given orally, how important is that compared to the other outcomes? And so it really makes this whole process transparent. It facilitates all of that, and it's a really exciting sort of journey that we're on with that. And so I just wanted to end with a survey of showing sort of how best practice is making a difference to people. And so in a survey that we did of our users, 96% of them said that best practice helped them to improve patient care. So, I mean, that's just huge. Nearly everybody that uses it finds it improves their practice. And not only that, nearly 80% said they changed their clinical practice as a result. And I think that goes back to just the difficulty of keeping on top of everything these days. It's impossible almost in your own specialty, let alone if you start seeing people with other problems, or you're in primary care and seeing such a wide range. It also helped people with giving evidence-based information to patients, so that shared decision-making and improving patient satisfaction. And also importantly, it helped save people time. So thank you very much for listening to me. We have a stand outside. If you'd like to know more about best practice, do come and talk to us. And we'd also be very happy to give everybody here complimentary access to the product. So please do come and see us. Thank you.